Hey, so I wanted to pop on real quick and talk a little bit about the idea of having a wait list for your private practice. There are pros and cons to it. Some people I know do it. I personally don't, and I'll go through kind of my reasons why. So before I kind of go into depth, I'm going to start with a little disclaimer that, again, I don't use a waitlist in my practice, so the information I have is slightly biased. Um, if you are seriously considering using a waitlist, I would find and talk to people who are doing it to see what works and what doesn't for them so you can make an informed decision. But I'm going to talk a little bit again about my experience and then also some things that I've heard from people how they've managed it if that is something that you're choosing to do. So the idea of a wait list is you are full or pretty much close to full, which is, yay, a great problem to have. Um, but people keep calling you. And so what do you do with them? Because at some point, the current clients that you have are going to discharge or might take a leave of absence. And I mean, any good business owner would want to fill that spot so they're not losing revenue. Naturally, it would make sense to have a wait list. The difficulty with it in regards to private practice is, I mean, if people are seeking therapy, depending on your clientele, they're probably in some type of crisis. Now, hopefully, they're not in a safety issue, and if that's the case, I mean, waitlist is not an option. You get them directly to the emergency services that they need. But even if somebody is not suicidal, homicidal, but is in an emotional state of peril, having them on a wait list, you have to really weigh out the ethics of it and is it fair? I mean, if it's a matter of a week or two, then okay, that seems a bit more reasonable, especially if the client knows up front, hey, I'm not going to be able to see you for a first session until X date. So there's an expectation. And then if that's the case, making sure that they have one, if they're willing to wait. First of all, they might want somebody now, and if that's the case, to provide them with appropriate referrals. Two, if they say, okay, 2 weeks is fine, to make sure that they have resources for if they change their mind and need somebody immediately, or if the situation escalates, how can they either reach out to you or some type of crisis number to get kind of bumped up for immediate service, because you don't want somebody sitting there in pain with this hope that they're going to be seen, but yet there's no formally signed contract. They're not actually your patient, but there's like this verbal handshake kind of thing going on. That's the big reason why I don't do a wait list. I refer people out. What I've found with that is people are thankful for me connecting them with somebody who is a good match and it can help them immediately. So even if they don't work with me at that point, they might come back at a later point if for whatever reason they need additional services or the first person wasn't a perfect match, or they would refer me to a colleague or a family member that needs help down the road, and at that point I might be taking clients. So some things to consider when you're doing that. I don't from an ethical kind of standpoint, but I do know many people that do. If you are going to have a wait list, like I said before, have very clear expectations with the client or potential client, how long that wait list is. You want to make sure that they have proper resources if in the meantime they are in need of help, that they can get the help that they need, whether it is with a different counselor or emergency crisis services. You need some way to be in maybe not frequent contact with them, but at least connecting with them so you can check in with them. Hey, X spots are available, or anticipating that it's going to be a couple more weeks. Check in with their kind of mental status. Is that still an appropriate length of time for them to wait, or do they need services now? And then also finding a way to prioritize on the wait list who you're seeing, right? It's not entirely fair if someone's been waiting for 3 weeks, but then a crisis comes in. Like, obviously you have to manage the crisis, but then what about that person that's been waiting for 3 weeks that keeps getting pushed back and pushed back? So again, things to consider. There are benefits to it because then you're constantly full in a sense, but you do want to make sure that you're treating people ethically and kindly, because we're in a specific profession where safety is a priority, not just physical but that emotional piece. So again, reach out to people who are actively doing it if it's something you want to consider. Long and short, I don't do it. I just send out quality referrals, and Good Karma tends to gift me back when I need it most. And so that's been working for me, and hopefully it gives you a little insights of what might work for you.